My name is Dr. Elisabeth von der Lohe. I'm a professor of cardiology at IU Health. Heart disease is the most leading cause of death in women in the United States. So every other woman in this country will die from cardiovascular disease. That's a fact. And more women die from heart disease than men do. There are about 500,000 women each year who will die from heart disease and about 450,000 men. So it's an important issue. The fact that women die from heart disease more often, but they don't develop heart disease more often. One is there are more women alive at an older age than men are alive. In addition, a lot of women are underdiagnosed and undertreated, which increases their risk of dying and having complications. So it's very crucial to make the diagnosis early and prevent heart attacks, prevent complications of heart attacks and heart failure. Most of the heart disease in women occurs about 10 years later in life than in men, and most of the time it's post-menopause. The only exception are women who are diabetic, and especially women who are diabetic and smoke. These are particularly at high risk for heart disease. But in general, if there is no diabetes or no strong smoking history, it's after menopause. Like you hear it on the news all the time, to prevent all risk factors. So eating healthy, exercising on a regular basis, losing weight, taking care of blood pressure, high cholesterol, not smoking. If you are diabetic, take care of the diabetes. So attacking each risk factor. The most common form of diagnosis is made with simple EKG, an echocardiogram, and a stress test. In the future, I see that MRI and CT scan may play a larger role as well. One downside of the CT scan is the high amount of radiation, and especially women's breasts are very sensitive for changes due to radiation, but MRI may be another tool we will use in the future more often.